Welcome to part 3 of this lecture series, Psychosocial Skills for SMD 210. You might be wondering, what are psychosocial skills? Who are they for, and why should we use them? Psychosocial skills or strategies are mental skills or techniques by which the individual can use the mind to control the body or to create an outcome. This outcome could be to motivate an individual or athlete, or to provide relaxation or stress reduction, for a few examples. We know there's a significant connection between the mind and body, and research has shown many of these skills to be very effective in motivation, relaxation, stress reduction, injury outcome, and even physical and competition performance, among many other outcomes. Here, we will explore and even try out some of these psychosocial skills. In the first half of this lecture, we will explore motivation strategies or techniques. These techniques can be useful for anyone in society who's struggling with motivation towards a task, and can be very helpful in the sports medicine or healthcare field. For patients struggling to get through treatment or rehabilitation, motivation techniques can be very useful. Let's take a look at some of these. Goal setting. A goal is an objective or aim of action. It's a specific standard of proficiency on a task, usually within a specified time limit. And there are several types of goals. Some are more useful in changing behavior and therefore achieving peak performance in a task, in particular when we're talking about athletes. There are various different types of goals, but here we're going to specifically talk about 3: outcome, performance, and process goals. Outcome goals focus on results compared to another individual, opponent, or team. For example, a goal might be to beat someone else in the 200-meter race, or to return to play earlier than compared to an NFL player with the same injury. Outcome goals specifically are focused on the result of someone else. Performance goals, however, focus on improvements relative to one's own past performance. So, for example, improving your own time in the 200-meter sprint, or improving your knee range of motion from 1 week to the next after an injury. Process goals focus on the procedures in which the performer will engage during the performance, on specific detailed tasks. For example, a field hockey player might have a goal of keeping her feet moving to avoid obstruction in the game. Or an athlete who's completing rehabilitation of their foot may have a goal of not touching down with their opposite foot during a single leg balance exercise. Goal setting is the most commonly used psychological intervention by sports psychologists for Olympic athletes, and it is also likely the most utilized psychosocial skill by athletic trainers. In addition, goal setting is used in everyday life by everyday people. The most effective goal setters, however, are athletes or individuals who employ all types of goals and have productive goal setting strategies. These include outcome, process goals, as well as performance goals. Goal setting in sports medicine is very important because it will especially help motivate your athlete towards better and more successful rehabilitation. The different types of goals in sports medicine include physical, psychological, performance, and lifestyle goals. Physical goals may be, for example, to increase active range of motion of knee extension. We talked about this with performance goals. A psychological goal may be to increase confidence about moving my knee after surgery. Performance goals would be to improve non-dominant cradling technique in a lacrosse player who's not playing right now but has a knee injury, and that's why they're out. Or maybe to improve stress management skills to apply later during competition, to somehow improve their performance while they're not particularly participating in their sport. And lifestyle goals are also important because it could improve or change the lifestyle of the individual. These goals might include something like increasing hours of sleep at night by not sleeping in as much or going to sleep earlier. Almost all of us set goals every day. It can't be that hard, right? Or is it? It might be a little bit harder than we thought. But how does goal setting help? How can simply setting a goal get an athlete to their peak performance, or maybe to return to play quickly after an injury? There are a bunch of different theories out there, but here we'll explore two of them. The mechanistic theory are goals that direct athletes' attention to specific important tasks, help the athlete mobilize effort, prolong effort and persistence, and learn new strategies. So, for example, a pitcher may focus on the mechanics when releasing the ball, and their goal will be to improve those mechanics and therefore improve their performance. There's also a cognitive theory type of goal setting. Goals are linked to athletes' level of anxiety, motivation, and confidence, including their perceived ability. So, back to our other example that we talked about, if an athlete doesn't touch down with the opposite foot during a balance exercise, they may have increased confidence after doing that exercise, increased self-efficacy, or their belief in their ability to perform a task, as well as decreased anxiety about performing that task. So those goals are specifically linked to their psychological evaluation or their cognitive appraisal of their ability to do a task. There are many different factors to consider when setting goals. Let's explore some of these factors here. Goals should be specific. They should be measurable, and they should be in behavioral or action terms. For example, an athlete might set a goal to be able to perform 25 push-ups by the end of the season. This is measurable, in which you can measure 25 sit-ups, and the behavior or action is to be able to do the sit-ups. Goals should be moderately difficult, but they should also be realistic. You should include short-term goals or long-term goals, and those terms or timelines should be identified. Ideally, you will set process, performance, and outcome goals, many goals in each type of category. If we're talking about athletes, goals should be set for specifically practice and/or competition. Ideally, goals will be positive or in a positive frame versus negative. For example, a positive goal might be to conduct a task in the correct manner. A negative goal would be to not perform an error on a specific task. Ideally, you will frame a goal in a positive frame or mindset. Every goal should also have a time frame. So the previous example of performing 25 push-ups, the time frame was by the end of the season. Short-term goals might be within the next couple of days or within the next 2 weeks, versus long-term goals, a time frame might be over the next 3 to 4 months or by next year. There should also be goal achievement strategies. How will these goals be achieved? And therefore, smaller task goals should be created to then achieve the larger or long-term goals. Goals should also be recorded. There has been research that has looked at or examined the difference between individuals who set goals and actually write them down versus individuals or athletes who never actually recorded the goals. And those individuals who actually write down or record the goals are more likely to achieve them. And lastly, goals should be evaluated. Was the goal achieved? Why or why not? There are also various goal-setting mistakes that individuals may make, and therefore not achieve their goal. If there are too many goals set too soon, there's likely to be failure. It's also important to recognize individual differences. If we have a team of 25 soccer players, not everyone should have the same exact type of goal or timeline or task. Goals should not be too general. And if goals happen to be unrealistic, or you find that a goal may be unrealistic, it should be changed and reset or reframed. It's often a mistake when individuals fail to set process and performance goals and instead just focus on outcome goals such as, let's win the championship at the end of the season. Time frame and commitment issues often are mistakes in goal setting, as well as only setting technique-related goals versus overarching goals or process goals. And lastly, not fostering a supportive environment. So if the least amount of social support an individual has, possibly the less likely they're going to achieve a goal. The SMART model is one of the most common models or ways to set a goal. If you can remember SMART, then you should be able to effectively set a goal. SMART stands for specific, measurable, achievable, realistic, and time frame. Goals, as we previously discussed, should be specific. You should specifically identify what the goal is. It should also be measurable. So, for example, our previous example of performing 25 push-ups, 25 is the measurement. It should be achievable. I think for, let's say, a college-level athlete, 25 push-ups within an entire athletic season seems achievable, and it also seems realistic. And lastly, it should have a time frame. So again, our example said to perform 25 push-ups by the end of the season. By the end of the season would be the time frame. Here we have an example from one research study of a roadmap examining the impact of a systematic goal-setting program for collegiate women's tennis players. And here you can see a different timeline, or 3 steps to a timeline, that leads up to the end goal, or the success of the accumulating event. This might be winning the game, or long-term winning a championship. You can see that there are smaller short-term goals, and those are the goals with the specific numbers on them. And then these goals lead up to levels, or the timeline, and create the intermediate goals. And these intermediate goals encompass or lead you to the end goal or the long-term goal of success, whatever that goal might be. You can see breaking down goals into short-term, intermediate, and long-term goals will help, quote-unquote, an athlete climb the ladder of success. Now let's switch gears and talk about positive self-talk. Self-talk is the internal and/or external statements to the self. It's multidimensional in nature, and it has interpretive elements associated with their content. It is dynamic and serves at least 2 functions, instructional and motivational. So self-talk is essentially carrying out an internal dialogue with yourself. It's the conversation you have with yourself in your head. Usually, it includes giving yourself instructions, telling yourself what to do, what to perceive, how to think, how to feel, and this can also be motivational. Self-talk happens naturally. It's your internal thoughts, and it can be positive or negative. Positive self-talk is a skill in which individuals seek to improve the self-talk or make it more positive in their mind. This ties into cognitive reframing, which we'll talk about later. So, an example of positive motivational self-talk would be, I can do it, or just hang in there as I'm running up a hill, for example. An instructional self-talk might be, keep your eyes on the ball, focus on the ball, or bend your knees right before the golf swing. Affirmations. Affirmations, or repetitive focus on a mantra, is another type of psychosocial skill. An affirmation is a statement made to the self to encourage, motivate, and improve self-worth. This is very similar to positive self-talk. Repetitive focus on a mantra is repetitive positive affirmations to encourage motivation. So a mantra might be go, 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 or one more lap, one more lap, one more lap. An affirmation might be, I believe in myself and my abilities. I believe in myself and my abilities. Affirmations and repetitive focus on a mantra can help motivate an individual and also change their mindset or their thinking. Lastly, we're going to talk about rehabilitation adherence strategies. 3 main strategies here might include rehabilitation contracts, menus, or partners. So any individuals performing any type of rehabilitation in the healthcare field might be able to employ these skills with their patients. A rehabilitation contract might be employed if an individual is having trouble getting motivated and getting to rehab. By writing a written contract and having them sign it and say, yes, I will attend rehabilitation or my treatment session. I will be there and I will attend X number of treatments each week for the next 3 weeks, for example. The individual or patient will then sign the contract as well as the healthcare provider. Hopefully, the contract helps motivate the individual to stick to the contract and come to rehabilitation. Rehabilitation menus might motivate an individual in their actual rehabilitation process. Sometimes, especially when we're talking about physical rehabilitation, rehab or treatment and therapy can be exhausting and sometimes can get boring. By providing a menu or options for the individual or patient to be able to choose from various different exercises that may have the same type of outcome, the individual might be a little bit more motivated to complete their rehab or complete specific exercises. You could have various different options on a menu for the different goals you might have. So if you have goals to increase range of motion of the knee, increase strength of the muscles around the knee, maybe you give 3 or 4 different options of range of motion exercises and 3 or 4 options of strength exercises and have a patient pick 2 or 3 from each. This also gives them confidence in themselves because they can choose and take control over their rehabilitation. And lastly, rehabilitation partners or buddies is another task or skill that you can employ with a patient who's completing sports medicine rehabilitation. By having one patient perform rehabilitation with another, especially when you're talking about athletes who are injured but maybe on the same team, they can perform rehabilitation together. Maybe they're doing single leg balance and tossing a ball to each other, or motivating each other through different range of motion exercises. By giving them a partner, someone else to motivate them, they may be more successful in the rehabilitation. Take a break now and then move on to the next video regarding psychosocial skills.